My name is Emily Lester, and today I'm going to tell you about the process of an angiogram. The information contained in this speech is for your general information only. I do not give medical advice or engage in the practice of medicine. I under no circumstances recommend a particular treatment for a certain individual, and in all cases recommend that you consult a physician or a treatment center before pursuing any course of treatment. The process of an angiogram usually lasts about a day, about 8 hours. To obtain an angiogram, you would need a referral from a physician, usually from a surgeon. An angiogram is a diagnostic procedure that maps arteries or veins in the body and either does micro treatment, which is through micro wires and micro catheters, or maps out an area for a surgeon to go in and repair an area that's either blocked, damaged, or aneurysm. Most angiograms are elective tests. Emergencies do occur, and these emergencies would be lack of flow to any part of the body. This would be no blood flow at all, or a patient is hemorrhaging due to an injury, like a gunshot wound or a car accident, where an artery needs to be closed off really quickly. Reasons someone might have an elective angiogram are leg pain with walking that gets worse, cramping in the muscles, poor circulation to some part of the body, could be anywhere in the body from head to toe, or most commonly there's a blockage in the legs due to fat deposits or scar tissue or blood clots. When you come for your angiogram, you will have a workup that includes blood work, a history and physical, medication reconciliation, which checks for contraindications. They might start an IV, and they will also shave the area that they will be working in, most commonly the groins. The labs check for kidney function and how well your blood clots, which is very important. Your kidneys must function well in order to process the dye that will be given to you in order to obtain the pictures. After all of this has been done and you are deemed ready for the procedure, a doctor will come in and make sure that you understand the risks and benefits of the procedure and the alternatives and ask you whether you're ready to proceed. You will then sign a consent form. After this is done, the nurse will take you to the procedure room and they will begin prepping you. Prep includes using sterile equipment, sterile gloves, and brand new equipment for every patient to prevent infection. They will set up a tray that has all your equipment on it, and they will also prep your groin or wherever else they might be going in the body with a special soap that has alcohol and another ingredient that kills germs for 24 hours. After this is done, the doctor will come into the room, put on a sterile gown and gloves, and begin your procedure. The procedures begin by numbing the area they will be working in, usually the groin because the arteries are usually the largest there, with a medicine called lidocaine. If you've ever gone to the dentist, you had lidocaine, and you know it stings and burns for about 25 seconds. This is usually the most pain that is had during the procedure, since your arteries do not have nerves in them, and the rest of the procedure usually doesn't cause pain. You will feel a warm sensation when the dye is injected in your body, and you may also feel like you've urinated on yourself, but this usually does not happen. We usually do not put people to sleep when these procedures are done because it is safer if the patients are awake and able to talk to the staff and let them know they are doing okay. Your artery will be accessed with a needle. A wire will be put in through the needle to guide the catheter that they will use. The needle is then removed and a catheter is placed over the wire. The catheter allows the doctor to inject dye in certain areas in the artery to look at the blockages. This is a picture of a normal artery on the left and a blocked artery on the right. Blockages would be right here, and this can be caused by fatty deposits called plaque, blood clot, or scar tissue. If blockages are found, the treatment could be, depending on where the blockage is, a balloon, which if you were to think, if you put a balloon in a jar and blew it up, it would smash everything against the side. This is what a balloon does in the artery also. If the place keeps collapsing, they may then place a stent that holds the area open permanently. This is a picture of before with the wire through the blockage, then the balloon, and it smashed the area to the sides, allowing the flow to be restored. Sometimes this treatment is not able to happen, and you may have to go to a surgeon for what they call a bypass. After your procedure is over, the person in the room with the doctor will pull the catheter out of your groin and hold pressure for 20 minutes. 20 minutes is necessary to obtain hemostasis, which is clotting, to allow the artery not to bleed anymore. You will then have a 4 to 6 hour recovery afterwards, depending on your procedure, and you will go home and take it easy for the next 2 days. You should not do any heavy lifting or anything that could open the artery back up. You should not expect to have more than a Band-Aid on the site. I hope you now understand what an angiogram is, and if you were to have one, that you would feel more comfortable going and having it. Thank you.